हेलो एंड नमस्कार सभी को। मैं हूं आपकी होस्ट दिव्या एंड वेलकम टू टुडेज लाइव सेशन। वार्म greetings everyone. I'm Divya and I'm excited to connect with you all in the session.
Viewers, don't let flu win. Conquer the season with our expert insights. So, viewers, we are going to discuss about the flu and its treatment today with our expert Dr. Umesh Sharma.
So let's get started. We have our expert Dr. Umesh Sharma for today's session. Dr. Umesh Sharma is a consultant with the Department of Hospital Internal Medicine and an assistant professor of medicine at the Mayo Clinic College of Medicine. He has 15 years of an experience. Dr. Umesh, you always bring lots of information to our viewers. It's really nice to meet you virtually. So without further ado, let's welcome Dr. Umesh. Hello, sir. How are you doing this evening?
Well, it's my pleasure. Thank you so much for this opportunity, and definitely pleasure to be back again.
That's great. So without any delay, should we dive into the session?
Absolutely, sure.
Yeah.
So, Dr. Umesh, as we are going to discuss about the flu and its prevention and treatments, so my first question is, what is influenza and how does it differ from the common cold?
So, common cold is caused by various viruses, including rhinovirus, coronavirus, adenovirus, and other viruses, while flu is typically caused by type A and type B flu viruses. Usually, common cold affects the upper part of your face, usually runny nose, congestion, sneezing, cough, while flu typically affects upper as well as the whole body. You can have upper symptoms along with generalized body ache, muscle ache, headache, really violent cough, and just malaise, don't feel like doing anything. You feel like you've been hit by a truck. And sometimes flu can have complications, especially you can get sinus infections, some bronchitis, pneumonia, and if you have underlying lung disease, it can get really more complicated. So, in short, flu is just a really bad, really bad cold.
Okay, so building on that point, I would also like to delve into like what are the common symptoms of the flu and how long do they typically last?
So, typically, flu can range anywhere from asymptomatic or mildly symptomatic, where you have just upper symptoms like runny nose, congestion, cough, sneezing at times, sinus symptoms, or it could be a full blown, really bad case of flu where we have generalized body ache, weakness, fatigue, bone pain, just really down. Sometimes people can get dehydrated from not eating and drinking. Symptoms can last anywhere from a week or two, depending if you get treated and also if you have underlying baseline comorbid problems. Nowadays, some treatments are available that may tend to shrink the duration of flu itself. So typically, a 1 to 2 week duration is pretty typical for flu.
So before moving to our next question, viewers, we are live on Facebook, Instagram, Twitter, YouTube, and LinkedIn. So you can join through your favorite platform and you can ask your doubts in the comment section.
Okay, so Dr. Umesh, like how does the flu virus spread and what precautions can be taken to prevent it?
So, like all the respiratory viruses, typically flu spreads by, like we call it, droplet. So when I cough or sneeze, it tends to spread the your saliva and respiratory secretions into like aerosol. And anybody who typically comes in between 5-6 feet, if they inhale, they can get sick. That's the most common cause of spread. The other one is, say, if I cough and some of my droplets lie on the table or the surfaces, they can stay there for a while. If somebody touches it and they touches the nose and mouth, that can also spread. So typically it's person-to-person transmission or through inanimate objects like door handles, computer keyboards, and things like that. So usually, the best way to prevent it is common sense stuff like, say, if I'm sick, the right thing to do is to stay quarantined until you're coughing. If you have to go out, make sure you mask so you don't make somebody else sick. Wash your hands with soap and water, or plenty of soap and water. Just like COVID has taught us, that's probably one of the best ways we can protect ourselves. Some obviously flu has flu vaccines. It makes sense to have the vaccine during the flu season, so at least you get some kind of protection against the flu itself. Obviously, if you get sick, try to get treated early. There's a medicine, Tamiflu, amongst others, which you can take that is to shorten the duration of flu symptoms itself.
Thank you,
And oh,
Dr. Umesh.
and I'm sorry, one thing to remember is also if you know somebody's sick, right, obviously sick, try to stay away from them. If you have to, again, mask, glove, anything you can protect yourself with to make sure you don't get sick yourself.
Moving further, let me tell you to all the viewers that eGlobal Doctors is providing diet consultation. We have variety of featured categories as diabetes remission, detox program, weight loss, child nutrition, gut health, and many more. So you can register with us today at eglobaldoctors.com and book your appointment to get a proper nutrition coaching.
Thank you, Dr. Umesh, for sharing the cause of spread and what precautions can be taken. So, viewers, before moving forward, we are discussing about the flu and its prevention with our expert, Dr. Umesh Sharma. And you can ask your doubts and comments in the comment section on FB, Instagram, YouTube, LinkedIn, and Twitter. So, now turning our attention to a different aspect, I would like to discuss, like, can you explain the concept of flu seasons and why they occur?
So typically, there's some viruses, especially the respiratory viruses, have seasonal pattern. They tend to be quiescent or quiet during the summer or hotter months, and in the winter months, they are much more prevalent. There are many factors, like some of these viruses are much more stable in the cold, and they thrive a little more. In the winter time, we tend to stay indoors and not go as much outdoors. So there's a lot more people-to-people transmission. Uh, the virus also evolves of having some antigenic shifts that makes it much more virulent in the winter months. Obviously, in winter, people tend to travel, there's vacations. So all these factors together makes the flu kind of epidemic or like flare up in the winter time typically happens. In the summer, these things don't happen. So you don't see a lot of flu activity in the summer season.
Okay. So, Dr. Umesh, like, what are the potential complications of the flu and like who is at a higher risk of severe outcomes?
So flu, typically, depending on your immune system itself, as I mentioned earlier, you could be asymptomatic to really, really symptomatic, where you have complications like sinus infections, bronchitis, pneumonia. Sometimes people get really, really sick from pneumonia and get into septic situation and septic shock, ear infections. Or if you have underlying lung problems like asthma, COPD, a chronic lung condition that can be exacerbated by flu. Uh, Typically, it can be dangerous in people with extremes of ages. If you're like really, really young or really old, you're pregnant, somebody with chronic lung conditions or underlying immune disorders are definitely high risk. Chronic, undiagnosed, untreated diabetes, chronic conditions can really predispose you to a lot of complications. So the bottom line is extremes of ages, chronic conditions make you really susceptible, and symptoms can range anywhere from asymptomatic to really, really sick.
So, Dr. Umesh, your insights on this question were insightful about the potential complications of the flu.
So before hopping to our next question, viewers, eGlobal Doctors is one complete healthcare platform solutions for all your medical related issues and questions. And मजे की बात ये है that you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living room. So you can register with us at eglobaldoctors.com.
Moving forward, so let's also discuss about like how effective are flu vaccines and Dr. Umesh, why it is important to get vaccinated annually.
So the effectiveness of vaccine can vary from season to season based on different factors, like what's the match between the flu vaccine itself and the strains which are circulating in that season. The effectiveness is typically measured on how much the vaccine prevents you from getting sick, from getting hospitalized, from dying. Usually the effectiveness is anywhere from 40 to 60%. And the bottom line is how many people get vaccinated. Just because the vaccine is effective, but half the population doesn't want to vaccinate, then that's a problem, right? So the vaccine may be effective, but it has to also be matched with people who are willing to get vaccinated. So we all recommend try to get your flu vaccines at the start of flu season so you're protecting yourself and others. Another thing I tell folks is it's like wearing a seatbelt in your car. the seatbelt itself doesn't prevent accidents, but if you get in an accident, you're less likely to get harmed or die. That's what vaccines do. It doesn't really 100% protect you from flu, but if you do get the flu, you're less likely to get sick and die from flu. So we always recommend everybody, unless there are severe contraindications, to get the flu vaccine.
Yeah. Thank you so much, Dr. Mesh. We have covered a lot of regarding the causes, symptoms, and how does it spread. So I would like to hear your thoughts on like, are there any misconceptions about the flu that you would like to address?
Yes, so typically the one thing I hear as common, really commonly is, I'm healthy. Why do I need a flu vaccine? Uh, so again, that's a chance you take. I've seen a lot of healthy people getting flu and getting really sick. So the best thing you can do with the vaccine is take it. It doesn't really, it's not a big deal besides getting an injection. It's definitely going to prevent you from getting a lot of complications and hopefully prevent you from dying as well. The second thing I hear is, maybe the vaccine itself causes flu. Some of these vaccines are like attenuated or like toned down viruses. So they don't really get you flu. They just give you like a mini flu or like a trailer of a movie before the actual movie itself. So you get a little bit, like some people get sore arm. That's pretty much rarely. You can get a little fever, but the benefits are much more than the tiny risk you have to take with the vaccine. Sometimes the other thing I feel is, well, people get flu and they want antibiotics. Usually antibiotics typically work against bacterial infections, not necessarily viral infections. So what really helps is when you get the flu is isolating yourself, drinking a lot of fluid, avoid dehydration, staying indoors at least for a couple of days when you're really sick and coughing, and so you don't make anybody else sick. And early in the disease, you can take antiviral medications like of Tamiflu. There are a couple other medicines that you can take as well. These are Zanamivir, Mivir, and Permavir. So there's a couple of new medicines as well. But the bottom line is typically most healthy people things should get better by just supportive care and just staying hydrated and symptomatic management of your headache, body ache, cough, congestion, those kind of things.
Thank you, Dr. Mesh, for addressing the misconceptions about the flu. So, moving forward, so what are the latest developments in flu research and treatment options?
So there are a lot of ongoing research to really make these vaccines more effective, more efficient, to cover more strains. And now, with the COVID, the mRNA technology has been deployed to make these vaccines much more effective as well. There are new medicines that are always coming up in the market besides the Tamiflu, the Relenza or Zanamivir, and the Rapivab or Permavir. These are a couple of new medicines that people can use for flu symptom management, especially early in the disease within 2 to 3 days of onset. These drugs interrupt by blocking the function of neuroamidase A, and is an enzyme on the virus that prevents the release of these virus from the host cells and prevents replication. So a lot of work has been done by making the vaccines much more effective, easy to produce, at the same time, medicines that will help control the flu symptoms itself. But again, this does not negate the need of common sense things like washing your hands, uh, staying away from sick people. If you're sick, masking yourself, and common sense things like getting your vaccines in due time.
Okay, so Dr. Mesh, like we just experienced the pandemics recently. So, how does the flu impact public health, just like COVID?
So typically, most public health organizations, that is any country, have limited capacity, right? You have limited beds, limited clinic capacity. And if you can avoid a pandemic like the COVID itself, or even epidemic or small kind of flux in these populations of sick people, then that's what you want to do with those vaccinations. In bad situations where you have a vaccine which isn't as effective, that's when you really see sudden spike of flu cases. And we see that once in a while in the US, where some years the vaccine is not as effective. That's when you get a lot more flu cases and a lot more people coming to the hospital for getting admitted. Infections using resources in the ER, hospital, ICU, what have you. And they tend to exhaust the capacity cushion the healthcare system does have. And also, not to mention people with chronic disease like COPD, asthma, they tend to make those conditions even worse. So the bottom line again is to be mindful, taking all the precautions, making sure your sickness doesn't contribute to everybody else getting sick, and you're not part of the problem when there's flu going around. In fact, you're part of the solution. So that's something we all have to be mindful about.
Yeah. Thank you, Dr. Umesh, for sharing these wonderful insights about the flu. So, moving forward, can you share some tips for managing flu symptoms at home?
So typically, most flu symptoms in most healthy people, you would not get as sick. So the recommendations are staying home, at least quarantining yourself for the first few days when you're really infected, when you're coughing, sneezing, you know, throwing the virus all over the place. So isolating yourself, make sure you drink enough water, stay hydrated, don't get dehydrated, maintain adequate nutrition. Sometimes people lose appetite, so drinking warm soup, juices would be helpful. Making sure you drink Gatorade and things that'll keep your electrolytes balanced. Symptomatic management of headache, body ache, cough, congestion. If you are within first 2 3 days of symptom onset, taking medicines like Tamiflu does help shorten the duration of flu itself. So those are typically things what you can do at home to keep yourself safe. And obviously, if you're sick, try not to go out. And if you do really have to, wear masks so you don't make anybody else sick. So those are typically what common sense things and just home remedies you can try. Again, that there are some folks who try, lemon, ginger tea or saline gargles to help with sore throat. So those things you can obviously try. But again, the bottom line is it's typically tends to be self-limited in healthy people. Early intake of Tamiflu may help. Symptomatic management is definitely the key of keeping you healthy and getting through that 1 or 2 weeks of sickness.
Yeah. So thank you, doctor. Viewers, there is no need to worry because we are here to help you at the comfort of your home. And you can reach out to Dr. Umesh, our expert on eGlobal Doctors, if you need any help regarding your health problem. So Dr. Umesh, we have discussed so much on the topic. So I think those audience who just has joined us, so can you provide a summary for prevention strategies?
Right. So flu definitely is a real problem in the winter season. Besides flu, there are other respiratory viruses. And something to think about now is RSV, respiratory syncytial virus, especially in people who are 65 years and older with chronic conditions. And now there's a vaccine that's available against RSV as well. So prevention is better than cure. Get vaccinated, whether it's flu or RSV in the flu season. If you do get sick, try to quarantine yourself so that you don't spread it to others. If you see somebody who's sick, try to stay away from them, at least 6 feet. Wash your hands with soap and water so you don't spread those germs and then un- inadvertently get sick yourself. If you do get sick, stay at home. Uh, have symptomatic management like treating your headache, drink plenty of water, fluids, warm liquids, and just stay safe. And again, if you decide to get vaccinated, obviously do vaccinate, and people around you try to convince them to vaccinate as well.
Thank you, sir, for providing lots of information about the topic. I think our audience has got lots of useful information about the prevention and treatment. So don't need to worry because experts at eGlobal Doctors are here to help you. So you can visit our website, eglobaldoctors.com, or you can download our application now.
Divya, it's a pleasure. And again, please get vaccinated. Stay healthy, stay safe, and happy holidays. And again, thank you so much for the opportunity.
So before wrapping up the session, viewers, are you looking for an expert second medical opinion for cancer treatment? Well, look no further because eGlobal Doctors is providing access to top oncologists from across the world. So, Dr. Umesh, thank you for providing the strategies and treatments. Thank you, doctor. Thank you, audience.
Thank you. My pleasure. And thanks for this opportunity.